Let's review Zepbound. You're now ready to begin Zepbound through the Medicare GLP-1 Bridge Program. You want to know a little bit about it. This is Dr. Jonas, endocrinologist. We're going to cover a summary of how it works and what it does. Let's start with how it works. Generally speaking, we classify these medications as GLP-1s or medication that stimulate the hormone glucagon-like peptide 1. However, Zepbound is unique in that it stimulates that hormone, but it also stimulates the GIP-1 hormone, the glucose-dependent insulin-trophic polypeptide hormone. Big name, big effects. That's the other hormone that it stimulates. So it stimulates two hormones, and it's generally still classified in the GLP-1 program for the Medicare Bridge Program. And those hormones will have an appetite suppression effect, a satiety effect, you'll feel full. It talks directly to the brain. It also slows down the emptying of the stomachs, and the small intestinal system moves a little slower, so you'll feel fuller longer. As well, medicine tells the pancreas and the gut to make insulin to lower sugar. It tells the liver to stop making sugar. That helps lower the sugar. So it has a multitude of effects. It's got 6 doses, 2.5, 5, 7.5, 10, 12.5, and 15 milligrams. Unique to the Medicare program is Medicare patients will only be using the Zepbound Quick Pen. So this is a pen, the medicine is in the chamber. This is similar to devices that you may see patients use with insulin. So it is different than the disposable one-time use pen you may see on a television commercial. This is used 4 times. So for instance, if your dose is 2.5 milligrams, you will use this pen 4 times and then dispose of the pen. Also, you will handle the needle with this pen, unlike the disposable pen you may have seen in the television commercial. You'll twist on the needle tip, you'll twist it off, it's right up there, and then you'll grab some fat and give the injection through that pen. You'll then take off the needle, put the pen back in the fridge, and then use the pen again, so 4 shots per pen, and that each dose will have its own pen. 2.5, 5, 7.5, 10, 12.5, and 15 milligrams. The most common side effects are gastrointestinal or relate to your gut. They include nauseousness, vomiting, diarrhea, constipation, gas, burping, acid reflux, a whole lot of stomach side effects. And to go back to dosing, you want to move to the next dose or a higher dose when you tolerate the medication. So that's very important. Tolerate that medicine before you move to the next dose. You can move as quickly as 4 weeks. So if you think things are going well, you don't feel anything, and you're ready to move, then you can speak to your prescriber and say, hey, I'm ready to go to that next dose. There's other safety information on the prescribing information of Zepbound. Important to make sure that your prescriber knows your history, what meds you're on, and other issues that you may have, or bring up any questions that you may have in that information. But again, the most common side effects are gastrointestinal in nature. But what about weight? You anticipate losing between 15 and 21% of your starting body weight on the 5 or the 10 or the 15 milligram doses. Those 3 doses were the doses that were studied over a year to an endpoint to see how much weight a person lost, 5, 10, and 15. However, if you have a dose that you're comfortable at, that may be the dose that you stop at. One other important thing to know about Zepbound, it actually has the FDA approval to be used for the treatment of moderate to severe sleep apnea. So it has that approval separate from a weight loss approval. If that's a use of the medicine for your personal circumstances and your diseases, then you may be able to get the medication out of the Medicare Bridge Program and through your traditional Medicare prescription program. I hope that information is helpful and helps get you ready to start Zepbound through the Medicare GLP-1 Bridge Program.